My name is Briena Grant. I've been here in Cheyenne for my whole life. I am 24 years old. I'm 24 weeks pregnant.
On December 29th, Briena was home alone in Cheyenne with her dog, Rossi, when she began experiencing symptoms of a stroke.
I was a little dizzy and my head started hurting a little bit, so I sat down on the toilet in the bathroom to kind of regain my senses, I guess. And next thing I know, I'm laying on the ground. I hear my puppy here. I hear him scraping at the door and barking at me, and somehow I was able to get the door open.
At 24 years old and 24 weeks pregnant, she needed to get help quickly.
Saw my phone sitting on the counter in the bathroom, so I knew I had to get my phone somehow and call somebody. I was able to smack it with my hand, and it fell on the floor, and I was able to somehow get Siri to call my friend Brooke, so she was able to get here pretty fast. She called 911.
What Briena didn't know was that her medical team in Cheyenne already had been collaborating with Swedish Medical Center in Denver, Colorado, a Level 1 trauma center and the region's first comprehensive stroke center. Swedish is nationally recognized for its neurosciences program. The medical providers in Wyoming knew that a case as complex as Briena's could only be sent to Swedish. Arrangements were made for her to be airlifted to Colorado. This multidisciplinary team includes a neurologist, a neurointerventionalist, CT, lab personnel, and in Briena's case, an OBGYN. The team was briefed on her case and assembled to meet her upon arrival so they could quickly diagnose her condition and begin life-saving treatment.
Hi, my name is Jasmine Johan. I am one of the stroke coordinators at Swedish Medical Center. When a stroke alert is activated here, we are able to bring our whole team to the patient. Our whole team meets the patient down in the emergency room or wherever the patient arrives. For Briena, when she arrived, we had had a heads up from our teleneurologist that she was 24 weeks pregnant and coming in with what we call a large vessel occlusion. It allowed us to enable our entire OB team as well as our stroke team to meet her down at the launch pad in our emergency room. She was quickly evaluated by OB to ensure that the baby was doing well as mom, and then we continued on to the CT scanner to evaluate her scans.
I'm Dr. Julie Gelman. I'm an OBGYN hospitalist with the obstetrics group here at Swedish Medical Center. And I went down to the ER for the stroke alert, and we took a very brief moment for me to do a rapid ultrasound to determine the baby's well-being, mom's well-being, that size and placenta and everything was good, and then encouraged the stroke team to do what they needed to do. From the OB perspective, we set up fetal monitoring for during the procedure, and anesthesia was part of the team to make sure that mom was stable and vital signs were stable.
So we were notified by emergency services that Briena was getting transferred to Swedish Medical Center for treatment of her stroke. We knew from the outside hospital that she had what's called middle cerebral artery M1 occlusion. So her blockage was in the main trunk of the main blood vessel on the right side of her brain. So she had acute onset of weakness and numbness on her left side, and also the inability to recognize the left side of her body as her own. That's called neglect. We accessed the arterial system down by the large vessel by the hip, and at that point we could identify the occlusion, and we navigated a long, skinny catheter into the point of occlusion and applied suction to basically suck the clot out. That was fortunately successful and achieved within a very short amount of time.
Only 7 minutes into the procedure, the clot causing Briena's stroke was successfully removed, restoring blood flow to her entire brain. After the procedure was complete, Briena was transferred to the hospital's highly specialized neurointensive care unit to begin her road to recovery.
In the hospital, I remember my first night there in ICU when I was actually fully conscious. It was kind of a hard night for me because I realized I started realizing what had happened to me, and I think some of those feelings came back, and I think I had a little bit of a panic attack, you know, because a lot of different emotions going through, and knowing that I was 24 years old and 24 weeks pregnant and I just had a stroke.
I had gotten a report on Briena and what was going on with her from my colleague Jasmine. And so when she was out of procedure, I met her as soon as she was done in the neurological ICU. And right away, I was able to look at her and talk to her, and I could see the immediate progress that she had made. And then I was fortunate enough to be able to continue to follow her care as it progressed from the neuro ICU to watch her walk out under her own power when she was discharged from our hospital.
The procedure was completed, and the most impressive thing for me in the moment was watching interventional radiology inject the dye, and that there was not good perfusion for half the brain, and once the clot was removed, it reperfused immediately. It was truly saving her brain. And baby did well during the whole course. And then our team and the neurology team collaborated and took care of her while she was here at Swedish until she was discharged.
On April 3rd, 2023, Briena delivered a healthy baby boy, Barrett. She remains grateful to the teams in both Wyoming and Colorado for the rapid, expert care that saved both of their lives.